Welcome to the show, Dr. Kasturi. So, to start, could you share with us your journey and why did you choose this specialization of eye when there were so many other options available to you?
So, my journey began when I was growing. I grew up on a farm full of animals, and we had dogs, cats, horses. My dad is a agriculturist, and my mom is a cancer immunologist, but she chose to come and live on the farm. So we grew up on a farm, and while growing up on the farm, I absolutely loved my childhood, by the way.
I can imagine. We can only dream of it.
Yes. And so while growing up on the farm, we had lots of large animals, dogs, cats. But the problem was that whenever they fell sick, there was very little veterinary help available, and I could see that they were just dying. Not all the time.
Yeah.
But whenever they fell sick, there was nobody to help, and the help was very difficult to get. And I was good with animals. I loved animals from the beginning. So from early on, I had decided that I was going to become a vet. Now, when I got into veterinary college, after finishing the college, I knew that I wanted to become a surgeon. So I got, fortunately, I was fortunate enough to get into masters in surgery. Now, while doing my masters in surgery, I developed an interest towards ophthalmology because we could see we were getting a lot of ophthalmic cases, a lot of corneal ulcers, cataracts, and whatnot. And there was very little that we could do. We had few eye drops that we could suggest, and that's all. We were not really doing any ophthalmic surgery besides a removal of the eyeball. And that's an end stage procedure. It is necessary in some cases, but sometimes you don't have to. You can actually save the eye. So I got an inspiration. I wanted to research. For a master's in surgery, you have to do 6 months of research. So for my research, I wanted to choose a topic where I could actually enhance my skills. So I approached a human ophthalmologist. He's a very, very nice Dr. Agashi. And he became my external guide. He taught me how to perform cataract surgery. I learned on cadaver eyes, and then we successfully completed the cataract surgery research. And but I realized that cataract surgery is not the entire ophthalmology. It's a very small part of ophthalmology. It's a very highly skilled surgery that you need to perform when you already know a lot about ophthalmology. So I knew that, I realized it, and so I went into I visited Israel. I was in Israel for a month with Dr. Ron Offrey, and then I was in 6 months in the US visiting different universities, different ophthalmology setups to understand the world of ophthalmology, the veterinary ophthalmology. So through this journey, I realized that I know very little and I need to learn a lot, and that is the first step in learning something. That's absolutely the first step. So I did not stop the passion. I applied for a lot of residencies, internships. Ophthalmology is actually one of the most difficult residency to get into. Especially in the US, and you need a lot of. First of all, you need to be an American. There are very few non-Americans who get into it.
Oh, really? I thought if you could clear some exams, you could get into it.
It's not that easy at all. You need a very, very solid CV to get into ophthalmology residency. So I kind of continued the journey on my own. I did lots of courses. Then I got married and moved to Australia. I was in Australia for 9 years, and in those 9 years, I cleared my ECFVG, which is an American licensing exam. Which after passing ECFVG, you can practice practically everywhere in the world. So I was practicing in Australia, but as a general practitioner. But I did not stop the journey towards ophthalmology. So I was I used to visit a veterinary ophthalmology clinic. In my clinic, I used to do all ophthalmic cases, all different ophthalmic surgeries, and then after having 2 kids, I started my own mobile I had. Kind of thing. I did not want to start a clinic there because in my mind, in my heart, I wanted to come back to India.
Oh, that's very encouraging, because there are very few people who just go out and want to come back. You just
never.
stay there.
Not even a single day that I had even a faint doubt in my mind that I did not want to come to India.
Okay.
Because it is home. India is home, and you feel this is where the home is, and it's. I mean, Australia is nice. It's pretty. It's very very good. People are good. I mean, overall, it's a great place to live. But it's still, for me, my roots were very strong here. So I wanted to come back. And probably because my entire family. I mean, I do have a family history where my grandfather was a freedom fighter, right? So from there, it's very kind of I feel India is.
It's your home, that's great. And in fact, it should be an inspiration to a lot of people in general, and plus veterinarians also, that there is a lot of scope and you can do a lot and you can grow your career back here at home.
Absolutely. I mean, life outside India is, it's nice, but I mean, there are lots of challenges outside India. I mean, it's you're working non-stop, and there's very little help, and if you have young kids, raising them, and when they fall sick, you feel lost, and I mean, you kind of get used to it. I mean, when I was there, I never had a maid or anybody, or I didn't really have any help. But I used to manage everything okay. But
I do. It's better and more convenient here.
It is, it is, and the family is so close. Whenever I feel like I can visit my parents. Whereas over there, you just
it's an overnight flight. So it's tough.
It's not it's not a.
So moving on, I mean, it's a fascinating journey you've told me about. So just wanted to get into some important topics related to pets eye care. So can you discuss some common eye conditions that pets face, and how pet owners can identify those symptoms?
So, first we need to understand what is dolichocephalic breeds and brachycephalic breeds. Right? So dolichocephalic breeds are dogs with a normal shaped face. So normal as in longer snout, right, and eyes set inside the skull. And whereas brachycephalic breeds are, they're very cute, most loved pets currently in India, which is basically like pugs or Shih Tzus, where they have a flat nose. So they almost have no nose, and just very very flat. They have big bulgy eyes, and they're small. They're perfectly fitted for for apartment living. Now, so brachycephalic breeds. They're very popular, but the problem is with brachycephalic breeds is that they have brachycephalic ocular syndrome. Okay, so they have brachycephalic respiratory syndrome as well. So brachycephalic syndromes, but brachycephalic ocular syndrome means that they have dry eyes. They have excessively wide eyelid opening. So because of their excessively wide eyelid opening, their eyes are constantly exposed to the environment. A lot of and they sometimes their eyes are so wide open that they can't even close their eyelids, even while they're sleeping.
Oh, okay.
So and they have dry eye. They have pigmentary keratitis, which means that the pigment starts growing on the surface of the cornea, and then they have a lot of hair, right? So and they have a fold right here. So this fold kind of pushes the inner margin of the eyelid, and that rubs onto the cornea. So it's like multiple things combined together, which predisposes them to getting corneal ulcers. So corneal ulcers is one of the very common things that we see in our practice. Besides having the brachycephalic ocular syndrome, they also have some breeds tend to have extra eyelashes, and these extra eyelashes grow in the wrong direction, and they actually rub onto the cornea.
Right.
So these are some very very common things that we see. It's kind of associated with what breed you have. So if you have a small Shih Tzu, small pug, Pekingese, French bulldogs, big bulgy eyes,
boxers also will come in that. category? No.
Yeah, but I mean they tend to have less of a problem because you know their eyes are slightly inside, not really bulging out as much as pugs and Shih Tzus. Another most common thing that we see in this breed is proptosis of the eyeball, where sometimes they're eating or sometimes even they fall off the bed, their eyeball can pop out.
Oh my god.
It's mainly because their eyelids are so big and their socket, the socket in the skull, it's supposed to be nice and curved socket where the eyeball is well protected. Now, in brachycephalic breed, the socket is really shallow. It's kind of like a flat surface, and then the eyeball is right here. So a little bit of some pressure on the neck, and then the eyeball can pop out. So these are very common.
Like this is in my view an emergency. So what do you recommend a pet parent does when it happens? Something happens like that.
Yeah. So it is an absolute emergency. I mean, if the eyeball pops out, then you absolutely have to take your pet to a vet as soon as possible. Do not try to push the eyeball in. That's absolutely not something that you should do. And immediately take the pet to the vet. Now, and do not feed the dog because for the eyeball to set back in, you need to anesthetize them and you need to get the eyelids back in the position. So for that, for anesthesia, if the animal is fully fed, then anesthesia becomes risky, especially in these kind of breeds where the anesthesia is slightly risky anyways. So I mean that's proptosis of the eyeball, dry eye, cataract. These are another things which are something that we see commonly, but dry eye and ulcer are more common.
So in view of this, what do you recommend for pet parents that they should do in terms of regular eye checkups, or how do they go about doing this? Are there specific tools available that they can do some stuff at home, or they need to go to a veterinarian to get it done?
Yeah, so I mean, if you have a brachycephalic breed, at least one ophthalmic checkup is absolutely necessary. Because sometimes people think that with a brachycephalic breed, oh, my dog has a little bit of discharge in the morning, and it's fine. It's not even we get that. But with brachycephalic breed, a little bit of discharge, or sometimes people say that, oh, I have to clean the discharge few times in the day and then the eyes look good, but that's not it. Sometimes they have dry. It's just the start of the dry eye. Dry eye is kind of a root cause for multiple things, ulcers not healing, pigmentation, lots of things. Dry eye is a problem, and it is absolutely medically manageable condition. But you need to identify it in time, and you need to treat it correctly. And just putting gentle gel or artificial tears, or just you get refreshed tears, or just putting those drops is not enough. It needs to be identified and treated correctly, and then a lot of problems can be avoided if the condition is treated in time.
Right.
So
in terms of the breeds that you mentioned are predisposed, anything the pet parent should be doing at home? One is that they figure out there is something happening and then they go to a vet, but just to prevent or just to ensure that the eyes are all right, what are the things you recommend the pet parent should be doing at home?
So certain things is, I mean, if you see a discharge from the eye, even if it's even if you think that it's a little bit of discharge in the morning, I would recommend a checkup by a veterinary ophthalmologist, because as I said, it could be a start of the dry eye. So if you see discharge, if you see redness, if you see that your pet is squinting, there's watery discharge coming, I would recommend that they need to see a veterinary ophthalmologist. Because the reason I say veterinary ophthalmologist is because there are a lot of eye drops on the in the shelf, and sometimes putting one eye drop, and putting an eye drop which is not supposed to go into an corneal ulcer, can make things even worse. So it's better that somebody with ophthalmic experience is checking the eyes. The things that they can do at home is, you can clean with breeds with lots of hair. I would actually recommend not either tie their hair back or keep their face clean. I mean, get the
hair.
Get the haircut so that you can actually see their eyes.
Right.
Especially brachycephalic breeds. I mean, if you have so much hair just constantly covering the eyes, sometimes we've seen that the pet owners don't even know that their dog has a problem.
Yeah, because
everything is covered.
Yeah.
So that's one of the major things that I would suggest is keep their face clean. If you want long hair, then at least tie it up. If long hair is not a criteria, just keep the face clean.
Okay, so that's an important advice. And what do you recommend? Do cats have similar problems, or what?
Yes, absolutely. So cats, most of the cats tend to have, and they have a condition called as or an infection called feline herpes virus. It's a highly infectious disease, and you don't really, as an adult cat, they don't really seem very, very horrible side effects or have horrible effects of feline herpes virus. But young kittens tend to have a lot of that discharge, and sometimes their eyes rupture. It's very, very bad for young kittens because their immunity is very poor. But the symptoms of feline herpes virus are corneal ulcers, and sometimes they get non-healing corneal ulcers. Sometimes it starts with a little bit of sneezing, and then they have a little bit of discharge from the eyes, and that is the start of a virus. And this virus in particular is a virus where once the immunity takes over, the virus kind of goes to sleep, and it stays inside the body until the animal is stressed. Okay. Next time. So when the animal is stressed, basically the immunity goes down, and with the low immunity, the virus comes up.
Right.
So, for example, in cats, if there is the cat is happy, and healthy, dewormed, everything looks great, the virus will stay quiet. Okay. But a new baby comes in the house, and the cat is unhappy about it.
Yeah.
Or a new cat comes in the neighborhood, and the cat becomes unhappy, and then suddenly starts sneezing. Cats can get stressed very easily, and things like change in the weather, sometimes loud music, sometimes unwanted person comes in the house. All of these things can just stress them. And the virus comes up. The first sign is sneezing, then discharge. Sometimes they get corneal ulcers. So cats tend to have corneal ulcers. If their corneal ulcer does not heal, then they get a condition called as corneal sequestrum, which is basically only cats get.
Okay.
And it is a surgical condition. You can treat it medically, but it's not the most ideal way to treat it medically at all.
Okay.
And then they can get cataracts. They can get.
When you say medically, it means that the surgery is recommended. That's what.
Surgery is recommended for sequestrum. Sequestrum is kind of necrosis of the cornea, where that necrosis can grow and spread over the. It can go deeper. It can spread across the horizontally as well.
Right.
And it's a very painful condition for the animal. So
right.
And it requires surgery. Cats can get cataracts, and cataracts and these cataracts are usually hereditary cataracts. They do great with cataract surgery. Absolutely wonderful patients for cataract surgery.
Okay.
Better than dogs.
Okay.
But mainly because cats have, as a species, in their physiology, they produce less inflammation inside the eye compared to dogs.
Okay.
So there is a species difference.
So what advice would you give for pet owners regarding safe products to use for cleaning and maintaining pet eyes at home?
Yeah, so safe products. Why is that?
When I say that, you said that you need to keep the face clean or eyes clean.
Yes.
So, is there some products that can be
So
recommended?
tell me, what do you use to clean your eyes?
What?
Yes.
Yeah.
So your pets are not aliens.
Yeah.
Right?
So they are not supposed to use any medicated product, just plain water.
I mean, we won't use. I mean, we just go in the shower and just clean.
Yeah, until something is bothering, usually you wouldn't like to put an eardrop. Okay.
Yes. So I would just use like for if you are putting in effort in cleaning their eyes, I usually advise warm water.
Yeah. Okay.
The reason for using warm water is basically our eyelids have glands. They're called as meibomian glands. They are they secrete lipid or oily substance. So when you apply warmth to a butter, so butter melts and comes out. And so that kind of helps the glands to stay active. That helps to get the butter to melt and it starts flowing. So it helps in dry eye as well.
Okay.
So just warm compress tends to help, and can be done for us also. I do that all the time with my eyes.
Okay.
Then just put a little bit of warmth on your eyelids and it feels great. Another most important thing that I want to mention or to tell everybody is not to use shampoo around the eyes. Okay? Even dog shampoo. Because the shampoo, I mean, we in our clinic get a lot of complications associated with dog shampoo going in the eye. It can cause chemical burns and it can cause cardio ulcers. So it's very important to not use shampoo around the eyes. Okay, so when you take your dog to a groomer, make sure that you tell them not to use dog shampoo around the eyes. So how do you clean them, right? If you want to shampoo if they have mats and they need some sort of soap to clean it. The best thing that I would recommend is a no-tear baby shampoo or no-tear shampoo. Sometimes, I mean, I'm sure there are no-tear dog shampoos as well. So tear isn't tearing. Because in babies, I mean, when you're bathing your baby, if a shampoo goes in the eye, they don't really.
They like it and obviously there are stuff available.
There is a stuff available where it's a soap, but it's not harmful for the eyes. So that is something that we use when we have a very during the surgery, before the surgery, when we are preparing that place, and if there's too much gum, then we use no-tear baby shampoo, and that is safe. To use on the eye. So even if the shampoo goes in the eye,
it's safe. It doesn't affect, right? So that's a nice advice. So I just take a step back to where you started with your journey and why you specifically went into the field of veterinary ophthalmology. So I would ask you that what are you going to recommend to the budding veterinarians, that what is the scope in this field, and what is that they should be doing to specialize in this? Because what I understand is so far we don't have a field or a specialization in the country which is specific to veterinary ophthalmology.
So as a vet, as a vet student or a vet who is passionate towards ophthalmology, going outside India, going abroad is a one very long road which may not end up with a residency in ophthalmology. The reason being that I personally have experienced it. I have seen a lot of foreign veterinarians, a lot of European veterinarians who migrated to the US in hope to get into a residency, and it's not easy at all. You have to kind of spend a lot of time, at least 5 to 6 years in the country, doing multiple internships or research projects, and gathering all those good references before anybody will even look at your CV.
Okay.
So if you are up for that, great. I mean, that's one way to go for it. The second or the best option right now is a residency that we are offering at the IRA. Right? So we have a very well structured 3-year residency that we have created. The reason that we created this is because I went through the pain of it. Because I had to take the long road. I had to kind of train myself. I had to do it the very long way. And also the fact that I kind of lacked a mentor. And so what we have now is we have created a residency, 3-year residency where we have a didactic curriculum, which means that we have lectures which are delivered by 37 different subject matter experts
globally
in the world, right?
Yeah.
And who gets that? Even in the university in US, they have 3 or 4 mentors who are dedicated to that university. But these mentors who have delivered these lectures to us are from all over the world, and they are the subject matter experts. So that's a didactic curriculum. These are about 250 hours of lectures. There are a lot of exams in there, and there's a final exam. Besides this, we have a wet lab. So our residents go through wet lab training, very rigorous training. And then we at Mumbai and Pune clinic, we see more than 700 patients a month.
Right.
That's a significant amount of patient load that they can go through. They see that the animals are getting better with the treatment or not getting better. They learn through their experience as well.
Right.
So it's a very well structured program. So if you are a person who's or a vet who's interested in veterinary ophthalmology, okay, this is the best option that they can.
So how does one get into this program?
They have to send their CV. We will organize a telephonic interview and then in-person interview, it's very you have to kind of go through the process to become a resident. It's not difficult at the moment. It's when a specialty is beginning in a country, initially it's not difficult. But as more and more ophthalmologists come in the
picture, so you will have. So my question here is that is there a seat restriction you are doing that and they take a batch of 20, 30 right now? It's not that, or
no. So I am choosy about whom I'm that's
recruiting for your
yes,
course.
Because the person has to be dedicated.
Correct, I understand.
It's not just any other job where you want to try it for a few months or a few years and be done with it. The person has to be, has to have the right attitude. So, the first step is to apply for the residency, and then but there is no restriction as such, because what we want to do is we want to train as many veterinary ophthalmologists as possible. And as you know that we have a clinic in Mumbai, Pune, Gurgaon. Our next clinic is opening in Hyderabad.
Right.
So we want to go all across India. So we don't have any restrictions as such.
So that's great. So my last question here for today would be that in terms of career options, we primarily spoke about cats and dogs. So I'm sure this is applicable to other species, horses, camels, cows. So there is enough scope, right?
Yes.
And you are specializing in that.
Yeah. So veterinary ophthalmology is one of the specialties where you get to deal with all different types of animals.
Right.
Horses are my first love.
Okay.
I actually wanted to become an equine veterinarian after finishing my graduation. But then the course changed, and but the best thing about veterinary ophthalmology is I get to work with horses. So horses, dogs, cats, horses. And then we see a lot of exotic animals as well, because all these animals have eye problems. And whenever there is an eye problem, you need an ophthalmologist to treat it. So the scope is unlimited. Really. It's a huge, amazing field where you're working on only eye, but eye of multiple different species, and it's just fascinating.
So thank you, Dr. Kasturi, for your time today, and I wish you all the luck in your endeavors. And I'm fourth clinic. I hope to see many more in the country. So thank you.
Thank you for inviting me.